Okay, so I'm gonna do some skincare and talk about my chronic illness. So I have endometriosis. I don't really talk about it a lot because some people don't even consider it a chronic illness. They just consider it a period gone bad. Endometriosis is whenever your endometrial tissue grows outside of your uterine cavity. And so as a girl, you have a period essentially because your body is not harvesting the eggs and producing life. And so those eggs end up shedding and you bleed. That's why you have a period every month. However, for a lot of women, something ends up going haywire. The cause is not 100% sure. Some doctors will tell you that you need a laparoscopy for them to stick a camera in you and then do surgery immediately after. Others will just say this is just a bad period. You just need to change your diet. You just need to take pain pills a couple days before. You just need to drink raspberry leaf tea, all the things. There are some different things that people have said could be causes. So the first one is reverse menstruation. So this means that instead of your blood exiting through your vaginal hole, the blood is resurfacing back inside your uterus. Other causes of endometriosis that people have kind of attributed to, but there's no like set factor or set cause, has been genetics. So like for me, I have endometriosis. My mother and my nana, my grandma on my mom's side, they also have endometriosis. I've had it since I was 12. I started my period when I was 11. First year, no symptoms. When I hit 12, I can remember it clear as day. When I was in 7th grade, I started getting a lot of migraines. I started like losing my appetite a lot whenever I would have my period. I started throwing up like everything that I had. I would get like deep stomach and like vaginal cramps. I would get back cramps that would shoot up my spine. My breasts would be extremely sore. It would kind of be hard for me to like walk at times because of how much pain that like my joints and my muscles were in, and it really affected and still affects my quality of life. The longest period I had, I think it's been maybe 34 days, but unfortunately that number just continues to go up. And so if you have endometriosis, what are your options? Going to the doctor. Depending on where you're at is going to depend on what type of treatment you get. I was just stuffed with hormonal therapy since I was a kid. You can't really outdo tissue growth, if that makes sense. The ending result, unfortunately, is either going to be you having to get surgery, whether it be ablation, where they're like using kind of like a fire tool to like zap the cysts and the fibroids off in the extra tissue, or you're going to have to do excision surgery where they manually cut it out, and it's going to take a little bit longer, but you may have less scars instead of them zapping it away. But even then with those surgeries, the cysts, the tissues and stuff can still grow back. And then the last end result, which they unfortunately will tell a lot of women, is you can try to get pregnant to push all that tissue and the cyst out, maybe, or you can just get a hysterectomy. I'm 19. I don't want a hysterectomy. My life has just started, but I need to be able to manage it spiritually. I just started to get to a mindset where I'm remembering that God knows all, He sees all, and He hears all. I'm not promised a life with no struggle. Everyone's going to go through something. And while mine is terrible, I have to still keep persisting because the world is not going to stop just because I'm going through something. So it's been 7 years with endometriosis. I've learned a lot of things, and I will rejoice for the day when there is a cure. Amen. Amen.